President.
Senator from Iowa.
Mr. President, I ask that further proceedings under the quorum call be dispensed with.
Without objection.
Mr. President, today I am introducing the Seasonal Influenza and Pandemic Preparation Act of 2009. The bill was just given the number S953. This bill would establish a nationwide free voluntary influenza vaccination program under which any individual in this country may receive an annual influenza vaccine shot free of charge. Mr. President, I offered this bill 3 years ago, because at that time we started the process of building up our vaccine capacity. I'll have more to say about that. But what's happening now with H1N1 pandemic, flu being almost at a pandemic stage now, brings home again what we need to do in this country to be prepared. And that's what this bill is about. Offering free flu shots to everyone in the United States is a good idea in and of itself. The Center for Disease Control and Prevention says there's an average of more than 40,000 Americans die each year from flu-related diseases and causes. Think about that. 40,000 Americans die every year due to flu-related causes. Seasonal flu is responsible for more than 31 million outpatient visits and more than 3 million days annually in the hospital. Seasonal flu costs the U.S. economy nearly $90 billion annually, including $10 billion in direct medical costs. $10 billion a year just in direct medical costs. So think about that. 40,000 people dying every year. $10 billion in direct medical costs. $90 billion annually in lost productivity to our economy. Over 3 million days in the hospital every year. And this is seasonal flu. Now, we can significantly reduce all of those numbers. In addition, there's some evidence that people who are vaccinated each year against seasonal flu viruses actually build up a limited degree of resistance to pandemic viruses. So strictly, as a matter of prudent prevention, it's desirable to maximize the number of Americans who are vaccinated against flu each year. And by offering the vaccinations for free and making them conveniently available, we would remove major barriers to more widespread participation. Now, Mr. President, there is precedence for this. Medicare right now will pay for one seasonal flu shot for everyone on Medicare every year. So we already have that out there. We just now need to get to the rest of the population. There are other compelling reasons for establishing a nationwide voluntary free flu vaccination program. Let me explain. As the chairman of the Appropriations Subcommittee that funds health programs, I've taken the lead in the past in providing funding to prepare for a future flu pandemic. Since 2006, my subcommittee has provided more than $6 billion for these activities. As a consequence, while public health authorities in the United States may have been surprised by the H1N1 virus outbreak, they have not been caught unprepared. To the contrary, since 2006, we've undertaken very robust measures to prepare for exactly this kind of outbreak and potential pandemic. First, we've made major investments in antivirals that can be given to a person once they are exposed and once they show signs of the illness. And we've made major investments in medical equipment, which are now, right now as we speak, are being distributed nationally to our local public health authorities across our country. Many of them are now in place. Many of them started going out earlier this week, and I dare say that probably most of them, if not all, are probably out there right now. From the stockpiles that we built up, over 50 million doses of Tamiflu and Influenza that we built up in our stockpile. Now, not all of that, but most of that now has gone out around the country to be prepared. Secondly, we stepped up our public health and surveillance activities, which helped us detect the H1N1 virus earlier than we otherwise might have. Third, we've increased the capacity of the Center for Disease Control and Prevention to identify viruses and respond aggressively and very immediately, including producing what's called a seed virus necessary for the development of a vaccine. That's being done right now. Fourth, we've also made major investments in building up our vaccine production capacity here in the United States. Mr. President, when we started on this in 2005, there was at that time only one plant in the entire United States of America that could produce flu vaccines. One. I believe it was located in Pennsylvania. And that was making vaccines based upon an old methodology of using eggs. So we had to use millions of eggs every year on which to grow the viruses. And that takes a long time. There has been in the research and development now processes by which we can make cell-based vaccines. We can shorten the time frame. Well, that's nice, but we don't have any cell-based plants in the United States. So since 2005, well, actually in the fiscal year 2006 bill, we have put over $3 billion out to build these plants. And they are being built now. They're being built now. So we are building up our vaccine production capacity and doing it in a way in which we can get the vaccines produced more rapidly. Fifth, we have funded research into adjuvants. These are agents that increase a vaccine's effectiveness. So let me put it this way. If you have one dose of a vaccine, you might actually be able to cut that dosage down and maybe give that one dose to 4 or 5 people by adding an adjuvant to it, which increases its effectiveness. And lastly, we have worked with state and local public health agencies to boost their capacity to respond to a flu pandemic. Now, we have done that, but because of the economic downturn, many of our state budgets have been slashed. And in our states, we were told at our hearing the other day that some over 60,000 people have been laid off from our public health agencies in our states around this country. That makes it more difficult to get the antivirals out to people who may come down with H1N1 or any other kind of a flu virus. So, but because of all these things that we did, I think I can safely say there is no reason for anyone anywhere in the United States to panic because of the H1N1 flu virus. As I said, one of the most important things we've done is to build up our vaccine capacity, manufacturing capacity. Now, here's a problem. Here's the problem. And this really is the crux of this bill that I introduced today. So we build up the vaccine manufacturing capacity. And we build these plants that can respond aggressively and immediately to a pandemic outbreak. Well, what happens the rest of the time? What happens the rest of the time? They sit there idle, not being utilized? Well, you can't have that. What you need to do is to use these plants then to make more of the seasonal flu vaccines every year. Well, if you have the plants out there and they make more of the seasonal flu viruses, but not everyone's using them, what do? You just throw it away? So we want the plant capacity. to prepare for any pandemic in the future. But they need to be activated. They need to produce annually. Well, if they're going to be producing annually, then we have to find something to do with these vaccines. Well, by offering annual free vaccines to every single person in America, we will keep our vaccine production capacity up and running. And it will be ready to shift at a moment's notice, when necessary, from producing seasonal flu viruses to a mass production of vaccines to fight any future outbreak or pandemic. Now, there's another reason for this bill. If we are faced with a pandemic, a flu virus pandemic, we are going to have to mobilize people. We are going to have to get the vaccines out in a hurry, and we're going to have to get the vaccines right down to the individual person all over this country. People in small towns and communities, people in rural areas, people in cities. Well, by having an annual free flu vaccination, we will give public health agencies across America valuable experience in administering vaccines to masses of people. Local agencies will have a reason to develop trained cadres of people capable of administering vaccines. We will also develop an established network, an established network of sites. Might include grocery stores, shopping malls, schools, places of worship, senior centers, where people can conveniently go to get vaccinated in case of an outbreak. These annual activities will significantly increase state and local public health readiness to fight a pandemic. Now, not all these people are going to be employed by the government. These will be volunteers, but they will be trained. They will know where to go. They will know how to administer a vaccine because they will be administering these vaccines on an annual basis, free of charge to people. So we'll build up a network of sites. We'll build up a cadre of people that can be relied upon in case we do face a pandemic. Mr. President, on Tuesday, in response to this H1N1 outbreak, I chaired an emergency hearing on our Health Appropriations Subcommittee. We heard assessments of the outbreak from top medical experts, including Dr. Anthony Fauci, the very renowned and remarkable director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health. Now, he repeated again, but years ago when we first started this back in 2005, Dr. Fauci said at that time, he warned us. He said, it's not a matter of whether there will be a flu pandemic, but rather when it will happen. Not a matter of whether, but when. So when the Senate drafted its version of the American Recovery and Reinvestment Act earlier this year, the so-called stimulus bill, I included an additional $870 million for pandemic preparedness. Most of that funding was going to be used to complete the work of building up our vaccine production capacity. In other words, to get these plants built more rapidly. Unfortunately, it was taken out in the final bill. And again, what we're trying to do is to shift from egg-based production to cell-based production so that we can more rapidly get these vaccines developed. But taking it out in the final stimulus bill was a kind of typical short-sighted resistance that I've often encountered when I talk about this. In fact, some accused me a couple of years ago of crying wolf. Well, the wolf is here. And one day in the future, we can encounter an even worse wolf, like the flu pandemic of 1918, the so-called Spanish flu, which infected nearly 1 out of 3 people worldwide, killed more than 50 million people. It would be the height of folly not to do what we can to prepare for such a possibility. The harsh reality is that we have repeatedly experienced flu pandemics. I mentioned the one of 1918 and 1990. But there was the Asian flu, a pandemic of 1957 and 58 that killed over 1.5 million people. The Hong Kong flu pandemic of 1968 and 69, again, killed over 1 million people. Not only did it kill over 1 million people, it caused hundreds of millions of illnesses, hospital stays, all across the globe. So, Mr. President, we cannot predict the future course or severity of the current H1N1 outbreak. We can't predict it. But clearly, it is one more wake-up call. One more wake-up call. So again, I'm reintroducing, again, as I did 3 years ago, the Seasonal Influenza and Pandemic Preparation Act as a standalone bill. As I said, I first introduced this in 2005. But it's a standalone bill. We either pass it that way, or if not, I plan to incorporate it into the Prevention and Public Health title of comprehensive health reform legislation that hopefully we will pass this year. A program offering annual free flu shots to every American is exactly the kind of smart, cost-effective, prevention-focused public health that must be at the center of our reformed health system in America. It will save lives, and it will save money. And when, not whether, and when a pandemic flu strikes the United States in the future, we will be ready. So, Mr. President, I encourage senators to co-sponsor the legislation. As I said, I think that this is one more wake-up call, that we have to move ahead very aggressively in preparing for these pandemics. As Dr. Fauci said, it's not a question of whether, it's only a question of when. Now, and how severe it will be, we don't know. I remind people that just a few years ago, when we started this back in 2005, we were confronting the possible pandemic of an avian flu, H5N1 flu that started in Southeast Asia. Well, again, thanks to surveillance, thanks to the Center for Disease Control and Prevention, to a lot of people working on this, we were able to contain it before it got out too far. But this H5N1 avian flu virus is one of the most deadly we've ever confronted. Over 50% mortality. Over 50% mortality. Over 1 out of every 2 persons that contracted it died. Now, we've contained it. We've tamped it down, but that H5N1 virus is still out there. It's out there. Periodically, we pick it up here and there in Southeast Asia or places like that. There was some thought that because of migratory birds that it might be spread to other places. We don't know that. We don't know that. But because of that, because it's reared its ugly head, because we know that that virus is out there someplace, it behooves us to do everything we can to protect the people of this country. And in doing so, to prepare for that. I hope it doesn't happen. I hope that when there is a pandemic flu, it'll be just a mild one and won't kill people. We hope that, but we don't know. And the best way to prepare for it is to build up our vaccine manufacturing capacity as rapidly as possible. Secondly, make sure that our public health agencies on the state and local levels are ready to go, that they're trained, that they're equipped. And thirdly, that we have some experience, that we know how to do this. And one of the best ways is to give everyone a free flu shot every year. Everyone. A voluntary free flu shot every year. To me, that will set us up well to prepare for and to protect the American people against any flu pandemic that may come our way in the future. So, Mr. President, with that, I yield the floor and note the absence of a quorum.